The thought of attending the A&E department of a major hospital now fills prospective patients with dread, not in many cases caused by their illnesses, but by the additional misery they are likely to be subjected to during their almost interminable wait to be seen. Now we know that it need not be this way. Today's HICWA report was inspired by cases of people who were subjected to their final indignities in Tallaght Hospital.
My mum had told me she was up there on the day and she said it was the busiest she'd ever seen any sort of place like that. Yeah, he had his head up against a wall then and he was, trying to, because he was in a lot of pain, and he was like that for 8 hours, 9 hours, yeah.
What we identified in Tallaght was this was a thoroughfare, and on that corridor were patients, when we did the unannounced inspection in August, 9 patients on trolleys, some of whom had been there for 3 days. No privacy and dignity, no monitoring. We had patients who approached us at the beginning of the investigation who'd been cared for there. Someone had had a facial biopsy on that ward with no screens, nothing, with members of the public walking past with their children. That's unacceptable anywhere.
We want to see a situation where there are no patients on trolleys in corridors or parking areas in hospitals, and we're working very hard to achieve that goal.
The report makes clear that the management in Tallaght was simply not good enough. The effective management arrangements that were needed to facilitate the delivery of high quality, safe and reliable care were not in place, the report said. Today, Tallaght Hospital said that the new interim board was functioning correctly and had put patient safety at the top of its agenda.
It has set as a core to its purpose that we deliver safe, effective care to the people who use Tallaght Hospital as the place where they receive health care.
But much more worryingly, the snapshot that the investigators took of A&E departments all over the country on a single day late last August indicated that Tallaght is unlikely to be an isolated case, with waiting times to be admitted through A&E running to multiple days. The average waiting time to be admitted through A&E in Tallaght was over 14 hours, while the longest wait was 26. In Naas, the average wait was over 15 hours and the longest almost 67 hours, while the Mater had an average wait of over 19 hours with the longest wait of 38 hours. Beaumont's average wait for admission was little better at over 16 hours, and its longest wait was worse at almost 41 hours. Only St Michael's had an average wait of less than 6 hours and a longest wait of 6 hours. Other major hospitals were little better, with Drogheda having an average of 18 hours and a longest wait of 74 hours. Cork University Hospital had an average of 17 hours and a longest of 49 hours. Galway an average of 10 hours and a longest of 70 hours, while Portiuncula, with an average wait of 5 hours, took the dubious record of the longest wait for admission in the country at 138 hours or 6 days. Throughout the years of boom and bust, patients have waited for hours or even days on trolleys in accident and emergency departments all over the country, resigned to the fact that since nurses, doctors and hospital managers all told them that the problem was a lack of money, nothing could be done. This report seems to be saying that without a single penny in extra resources, much, much more could have been.
I think we could have a much improved service for our patients by doing what we're currently doing better.
So a lot of improvements could be made without additional resources?
I believe so, yes.
The report is quite blunt as to the root of some of the problem across the country. Incompetent personnel being left in place and their failures ignored. Ignoring poor performance and not having the levers in place to share good practice and to address poor performance is no longer acceptable in a modern-day health system, the report states.
And I'm not necessarily saying people should be sacked. I'm saying that the people in key positions should be suitably appointed and competent to do those.
And what if they're not competent? What do you think should happen to them?
Well, two things. Either they're developed to see whether they can do the job, but if they can't do the job in a senior position, then that isn't the job for them.
So they should be sacked?
Well, ultimately, if the performance is such that they're unable to do it, this is serious business. Either a suitable alternative role should be found for them, or they should not be running that job. So whether that's through a termination or whether that's through another alternative appointment, then yes.
But Tallaght Hospital should not have been allowed to fall down so badly. The report points out that it was the HSE which allowed that failure to continue. There was a failure also in the governance of the health system that should effectively hold a service provider in receipt of state funds to account, it said. But the question must be whether a health service structured as ours is even amenable to reform, or whether the good intentions of this report, like so many others, will be slowly drowned in the morass of a health service that seems no longer fit for purpose.